The next module of the CoC 201 training series continues our discussion of the CoC NOFA, and in this training, we're going to be looking at the CoC level application, often referred to as the consolidated application. So the CoC consolidated application is the overall narrative and application section of the CoC NOFA, which the CoC must respond to. And the questions really focus on what the CoC has been doing over the past year, what activities the CoC has been engaging in to address homelessness, and it also includes questions about performance and different data-driven measures. So the CoC Consolidated Application, you have to respond to questions around how the CoC is coordinating with other systems, the methodology and data from your point in time count and housing inventory chart. And then you have to respond to various questions about how your CoC is working to make progress on various goals. For example, reducing homelessness among subpopulation and improving your system performance measures. It's a pretty dense application that the CoC has to submit. And I will note, again, we mentioned earlier, there's two key parts to the actual CoC application. The part that we're talking about right now is the consolidated application, which includes narratives and attachments about what the CoC is doing as a whole. And the second part is the priority list. That's your list of all your new and renewal projects that the CoC is putting forward that year. And you have each new and renewal project has to submit an application in eSnaps, and then the CoC has to rank those projects. And again, we mentioned tier 1 and tier 2 in a previous module. You have to rank them and put them into tier 1 and tier 2. So right now we're going to continue talking about the consolidated application. Mentioned in the previous slide that one of the things you have to respond to in the consolidated application is how your CoC is performing on different data-driven measures. So HUD created the system performance measures to really drill into how the CoC is performing in different measures. They're really important because the CoC is supposed to be driving these in the right direction and making improvements on performance. So the system performance measures are measured by using HUD data, and the data that's inputted by CoC projects and also projects that don't receive CoC funding but are HMS participating contributes to the CoC's outcomes. So we try to use the annual scoring and ranking process to encourage projects to improve on these areas such as data quality and performance. So the different system performance measures that HUD looks at is the length of time homeless, so the average and the median length of time homeless in the CoC, how long it takes folks to exit homelessness to permanent housing. It looks at returns to homeless, so what percentage of folks are returning to homelessness after exiting to permanent housing. It looks at the number of homeless persons, primarily looking at your point in time count data. Jobs and income growth, it looks at what percentage of folks are increasing their income, whether it's through employment or non-employment income. It looks at the number of first-time homeless, so how many folks are experiencing homelessness for the first time. Measure 6, HUD has not been using over the past few years because most CoCs are not eligible to serve folks in category 3, which is folks who are homeless under other federal statutes. So for example, folks who are doubled up or couch surfing, but measure 6 looks at stabilizing folks in that category. And then measure 7 looks at the successful placement and retention of housing. So what percentage of folks are exiting to permanent housing, and for permanent supportive housing, what percentage are either exiting to permanent housing or retaining their housing. So these are the key measures that HUD is really looking for CoCs to make improvements on year over year. Another thing that the CoC application looks at is how your CoC is addressing homelessness for target population. So that includes veterans, chronically homeless households, families with children, youth, as well as all others experiencing homelessness. So HUD asks the CoC to outline the different strategies that you're implementing in your community to address homelessness for these different populations. So HUD scores each CoC application. So every single CoC in the country submits their application, and HUD scores the application based on key areas. So in this chart, you'll see that the areas that HUD looks at is project ranking, review, and capacity, system performance, HMIS, point in time count, performance and strategic planning, and CoC coordination and engagement. And we're going to talk a bit about what each of these categories includes. But one thing I want to point out is that you'll see that system performance has increased significantly in terms of points since 2016. So in 2016, system performance was worth 40 points, and now it's worth 60, and it's out of a total 200. So what that means is that the CoC's data, the system performance measures, which we just talked about, is really driving a good chunk of the points that CoCs receive for the NOFA scoring. Another one that has increased significantly is CoC coordination and engagement. So how the CoC is working with other mainstream partners to address homelessness. And you'll see a couple of the areas have gone down. HMIS, which is like, how are you implementing your HMIS? What's your bed coverage? What percentage of your homeless beds are participating in HMIS? HUD has decreased the point value. It's still very important, but HUD has really been emphasizing other areas in terms of the points. And the other area is performance and strategic planning. So the strategies your CoC has been implementing. While this is still important, it's still worth a sizable amount of points. HUD has really been moving in the direction of judging your performance based on your data, not just what you say you're going to do, but actually what your data is showing. So let's look at each of these categories and what HUD is actually looking at. I think by looking at this, it will really help you have a better understanding of what are all the different things that the CoC needs to be thinking about and working on in terms of addressing homelessness, and what are the things that HUD will ultimately be reviewing CoCs around. So the first area is project ranking, review, and capacity. So what this looks at is CoCs need to have objective criteria for how you're reviewing projects during the annual CoC competition. So like we mentioned, all renewal and new projects have to kind of reapply every year, and the CoC has to score and rank those projects based on their performance. So HUD says you have to have objective criteria that's data driven when you're looking at the ranking. It can't just be arbitrary, and it can't be the CoC saying, well, we like this project, so we're going to keep funding it. It really needs to be based on data. Severity of needs and performance. HUD requires CoCs to use a severity of needs criteria when you're scoring and ranking your projects. Basically what that means is if you have projects that are serving folks who are highly vulnerable, who have a lot of complex service needs, you need to figure out a way to factor that into your scoring so that those projects are not overly penalized for serving the hardest to serve folks. Reallocating projects. CoCs must engage in a process of thinking about reallocation, and HUD actually awards points based on what percentage of projects have you reallocated over the last few years. And what that means is if you have projects that are consistently underperforming or underspending, CoCs need to be looking at that and figuring out, do we still want to fund this project? Reallocation can be voluntary or involuntary. So voluntary meaning a project decides they don't want to, or an organization decides they don't want to operate the project anymore. They can basically give the money back to the CoC, and the CoC can use it to fund something new. Sometimes grants will also decide they want to decrease their total budget. Maybe they have some challenges with spending their whole budget. Reallocation can also be involuntary. That's a process that the funding committee would really lead and saying, if there's a project that's been consistently underperforming or underspending, we need to go through a process of looking at whether we want to continue funding them either fully or partially. And then you have to have a ranking and selection process, meaning you have to rank your projects, and you have to make this process transparent. You have to let both renewal and new projects know exactly what the process entails. You have to post information publicly, etc. So the second area is system performance. We've touched on this a bit, but HUD's really looking at data-driven elements. So they're looking at Is your community reducing the number of homeless individuals and families year over year? So are you seeing a decrease in your sheltered homelessness, your unsheltered homelessness? And HUD really looks to see a sizable decrease. HUD looks at whether you're reducing the number of first-time homeless persons. HUD looks at your length of time homeless. That's worth, as you can see, 14 points. That's a significant number of points on the NOFA. They want to see that you're decreasing the length of time homeless year over year. And they're really looking to see a pretty significant decrease of 5%. HUD looks at your successful permanent housing placement or retention. They want to see that more people every year are exiting to permanent housing. HUD looks at returns to homelessness. What percentage of folks are returning to homeless after exiting to permanent housing? Jobs and income growth. So HUD is looking at the number of folks who are increasing their employment from income or non-cash benefits. And then your system performance measures. Did you submit your SPMs on time? That sort of thing. The next category that HUD looks at, again, is the HMIS, Homeless Management Information System. So did you submit your HIC, your housing inventory count, on time? What's your bed coverage rate? So what that means is, of all the homeless projects who exist in your COC, what percentage of them are participating in HMIS? And HUD wants to see that at least 85% of your homeless dedicated beds are participating in HMIS. HUD also looks at whether your longitudinal system analysis, your LSA, was submitted on time. That's something that the HMIS lead is responsible for. HUD also looks at the point in time count. How did you conduct your count? Did you submit your data on time? And HUD also asks about how your COC specifically is counting youth and making sure you're capturing the needs of youth experiencing homelessness, the homelessness of young people often looks different than for older persons. In terms of performance and strategic planning, HUD wants to know what your strategies have been to end chronic homelessness. First of all, what does the data say? Have you been seeing a decrease in the number of folks who are experiencing chronic homelessness according to your PIT count? HUD wants to see what's happening about ending homelessness among households with children. So are you prioritizing households with children based on need? What is your strategy for rehousing for families experiencing homelessness? HUD requires that projects do not separate family members because of household configuration. So for example, you can't deny admissions to a family because they have an older teen in the house, or you can't deny a family because it's a male-headed household versus a female-headed household, things like that. So that HUD asks, are you following that requirement? HUD looks at whether you're decreasing family homelessness over time as evidenced by your PIT count. And HUD also looks at what you're doing around early childhood needs. So how is the COC collaborating to ensure that families with young children are receiving educational services and connected to resources? HUD also looks at your strategy around ending youth homelessness. So how are you prioritizing youth based on needs? How are you addressing the unique circumstances and needs of unaccompanied homeless youth? Are you increasing the number of housing resources and services for youth over time? And how are you collaborating with the education system, whether that's youth education providers, McKinney-Vento liaisons who specifically serve youth experiencing homelessness, your local education agencies, your school districts? In addition, HUD is looking at how you're ending veterans homelessness. So are you seeing a decrease in the number of veterans experiencing homelessness according to your PIT count, both sheltered and unsheltered homelessness? And also, how are you prioritizing veterans and connecting them to resources? As you can see, a lot of these elements are data driven. What does your PIT count say? What does your system performance measures say? And is the data moving in the right direction? We also have COC coordination and engagement. This looks at kind of your system and your structures for collaborating with other systems to address homelessness. So HUD looks at your COC structure and participation. A lot of this is around how are you inviting community partners to participate in the COC? How do you ensure that your COC is accessible to folks in the community who are also interested in addressing homelessness. HUD looks at how you're coordinating with other partners such as federal, state, local, private, and other organizations. The application asks about how you're addressing the needs of victims of domestic violence. What strategies are you using? HUD also asks about how you're protecting against discrimination and addressing the needs of LGBT individuals. Are you providing training? And what strategies are you using to address potential discrimination? HUD looks at your partnerships with public housing agencies, and specifically they want to know, are you working with public housing agencies to prioritize resources for folks experiencing homelessness? So PHAs can have what's called a homeless preference, so they can prioritize their affordable housing resources for certain populations, including folks experiencing homelessness. So HUD wants to know, have you had success with that? What are you doing to partner with your local PHAs? HUD looks at discharge planning and how you're partnering with other systems around discharges from public systems of care. Low barriers to entry. Does your system ensure that folks are not screened out because of barriers that they may have, whether that be employment, lack of employment, criminal history, sobriety, things like that? HUD asks about your street outreach strategy and how you're reaching folks who are kind of least likely to access the system. HUD looks at criminalization, which is what are you doing to work with your local partners to ensure that folks experiencing homelessness are not criminalized? Rapid rehousing, this is really looking at, are you increasing your rapid rehousing inventory year over year according to your housing inventory count? How are you connecting folks to mainstream benefits and other assistance? How does your coordinated entry system work? How is your coordinated entry system working to ensure that your homeless system is working efficiently and effectively? How are you addressing racial disparities in homelessness? This is new over the last couple of NOFAs, but HUD has really placed an emphasis that COCs need to be looking at racial disparities in their system, analyzing what's going on, and then creating strategies to address it. How are you promoting and increasing employment for folks experiencing homelessness? How are you promoting volunteering and community service? Affirmative outreach, which is how are you reaching out to folks who are least likely to access services? And then you can also get bonus points if your COC decides to merge with another COC, which doesn't apply to us, but that's something that HUD offers, especially for smaller COCs who could actually probably be more effective if they merge with other COCs in their community. So that's how the CoC NOFA application is scored by HUD. At least that's how they've been doing it over the past couple of NOFA rounds. One thing I'll note is there was not a CoC NOFA competition in FY20 because of COVID-19. So the last time we've actually seen a NOFA from HUD is FY19. That's the most recent one that we have as of right now, which is spring, summer 2021. So I hope this is helpful because I do think as a community, it's really important that we understand what HUD is looking at and that we're taking all of these various factors into account as we're developing a strategy to address homelessness.